Let's start with the asthma article. So what did I do in the asthma article? What was the design of this situation? What did I do with people here?
Either nothing or educated them on strategies to better manage the asthma.
Yeah, I put them through kind of an 8-week program. The other group was a control group. They went through nothing. Ethically speaking, is that okay to take people who have asthma and do nothing with them for 8 weeks?
Well, if they have the standard of care, it could be okay, but I know you said you deferred and gave them the intervention after.
Yeah, it was a waitless control group situation, so we gave it to them afterwards. That would be the ethical thing to do. But in this particular design, it was a 2-by-2 situation that I used. One variable was group, and what were the two groups? Whether they participated or not, so I called this up on the visual, up on the screen. One group was the control group, the other group was the treatment group, and there were large numbers in both groups, but actually the treatment group, we only ran like 5 or 6 at a time, so that was just, we pooled everything and just kept everything the same. So we had one variable that was group. Was that a between subject variable or within subject? It was between. You were either in one group or another, so that's a between subject variable. And I took all these people in both groups and I measured them at the same time, before and after. Would that be a within subject variable or a between subject variable? Within subject. I usually call that variable time of testing. I would call that variable time of testing. So let's say, for the sake of example, one of the things I measured, there's a scale out there that measures asthma self-efficacy. How well do you think you can do the task to help yourselves manage your asthma? Actually, and I think I've told you I had a few OTs actually helping me with this project. So that was a good thing. They were instrumental.
OTs are great.
So do we have any OTs in the room here?
OTs are great. Several.
Yeah, I kind of agree with that, because after my accident, I became very good friends with some OTs who, one of the first memories I have of after my bike accident is they brought some food into the hospital, and I just vaguely remember them coming in and kind of formed some close friendships with those people. But now that I'm not working at that institution anymore, we have to kind of let go of some ties. But that's a different story entirely. So if we were measuring self-efficacy, before we do anything, how would we expect these two groups to be? The same. So let's say self-efficacy was measured with a 10-point scale, if you will. So in the control group, I put the numbers 1, 2, and 3 in there. What's the mean of that group? 2. For the treatment group, 1, 2, and 3 in there, mean of 2. And if I did this all, oh, thank you. You said that with a very bird-like call, didn't you? It was almost a chirp. So if I started this off in August and September, and then the post-test was in late October, November, what should happen to the control group if nothing occurred for them?
Nothing.
Nothing. What should their numbers be?
The same.
The same. 1, 2, and 3, with a mean of what? 2 again. What should happen to the treatment group?
They're going to 9, 10. Should change.
Yeah, if we go for a 10-point scale, 8, 9, 10. Mean of that group is what? 9. So in this situation, this is a 2-by-2 mixed design. And this goes back to the point you made at the start about when you want to measure where they were to begin with. The answer is yes, you would. So it's a mixed design. because I have a between subject variable and a within subject variable, a between subject variable and a within subject variable, what's the most important statistical effect to look for? What are the three possible effects to look for? It's a 2x2 design, so what are always the three statistical effects you can look for?
Between groups?
Not quite. The three, oh,
So
you,
this is the
I guess for those
alcohol
three
pills or the
questions?
interaction.
the two main effects in the interaction. You could look for, no, you're all right. You could look for, is there a main effective time of testing? You could look for, is there a main effective group? And you could look for what? Is there an interaction? Which one is the most important question that I was interested in here? Is there an interaction? We would hope that the control group would stay what? The same, flat, a straight line going across. We would hope that the intervention group would change dramatically. The lines would be how? Non-parallel. Does this look like that situation?
Yes.
Yes, it does. And if you look through the article, if we go to the results section in here briefly,
Look at the tables.
Table 2 would be the one. So Table 2 on page 94. We got this published in a peer review. Does it look like quality of life total was a little bit better here?
Yes.
Yeah, the control group stayed the same. The intervention group actually started lower and went up. Was quality of life for environmental better? Nope.
No.
How about for emotion?
Yes.
Yes, marginally.
Marginally.
Same with quality of life symptoms, not activities. What about asthma self-efficacy?
Yes.
Yep.
Much better there. And patient activation was much better. If you look in the terms there, psychological outcomes, yeah, patient things and changing behaviors. Go ahead.
What is patient, how is patient, I'm just curious, what does patient activation mean?
There's a scale that measures patient activation that talks about, and we actually had a nice, reliable, and valid scale. It was $250. I just happen to remember that. It measures, when you go to see your provider, are you asking questions, are you engaged?
Okay.
And it's a nice, reliable, and valid scale that measures chronic health conditions and patients asking questions. Our patients were going back to their healthcare professionals and, hey, I'm wondering about my peak flow. I'm wondering about, should I be taking this medication or that one? And I learned in group tonight that, I'm taking this controller product. Is this the right one for me? And the healthcare providers, do you think they were surprised by this?
Yeah.
Yeah, they were very surprised, but we had guest presenters. Sometimes the guest presenters came in, and it was really funny. The guest presenters would come, and the allergist and the pulmonologist, and they would start chattering away. Guess what I would do with them? I would continue to interrupt them. Didn't you have an experience like this? What did you have? Because they're just not used to dialogue. They're used to, here's what you need to know. So we found that there. So this is a good example of a mixed design, going back to your question about pre-test before, and we found things there. Now, if you look at Table 3, behavioral outcomes, were they reading about asthma? Were they reducing asthma triggers? We found everything there to be just about statistically significant. And then even 2 months later, we just did simple t-tests. We found very positive results. The thing we're trying to do with this program now is make it an online program, actually, and teach healthcare professionals and even students how to learn how to run this. This is more tricky because the whole key for our thing was having a group of people together and talking, but we actually had a successful pilot run. We found a website that we could use called a group site, where we would say, tell me your asthma story, and people would share on that. And then after that, we would open up the first module, and say, what medications are you taking? What do you think they do? They would dialogue for a week or two, and then we would post little acoustic YouTube things with, that's very good that you said this, you said that, and we'd get them engaged in this kind of distance learning situation. So we have that article doing that. And last but not least, gait and posture. I thought this one would be a good one for maybe more on the PT side of things. So what I would ask that you do is turn to page 573. Page 573 under data analysis. Do you see that there?
Mm-hmm.
So they had how many independent variables in that first sentence? Looks like they had 2. So in the first one, they had groups as one independent variable, internal versus an external focus. I'm not exactly sure what that means. Maybe focused on yourself.
They defined that out here, so.
Yep. Looking at yourself versus looking externally.
The internal focus was they had them look at their feet, and then the external focus was.
They had a bar they were watching.
They had markers on a platform.
Looking further away, and then they did this across trials. Trials would be considered a within subject variable. So they did a 2 by 10 repeated measures to the last factor for this. And then they give the results there. There was a main effective trial, saying that as you went through trials, what would probably be the finding there? You'd actually want to do a post hoc there, that there'd be a main effective trials, because you'd find a difference across the trials, and then you'd want to know which trials did you actually get better, but you probably got better across the trials. And they say there was no main effective group. They report that actually correctly, 1.7 on page 574, p greater than 0.5. The interaction of group and trials was not significant. Yeah, actually, F 9-270, you wouldn't want to necessarily 9 and 270, usually just say F less than 1. So that basically means what? Doesn't really matter which one of these two things you do.
Whether you did internal or external.
They both work.
Yeah, they both got better.
They both got better over the trials, so that might be important. So this is the situation at hand here. A lot of people do ANOVAs. You can look at more than you can look at. So today, to kind of summarize, we started off with this idea that, yeah, can you do a t-test and an ANOVA on the same data set? The answer is yes. You could do the statistic. What's the relationship between getting a t-score and an f-score?
T squared equals F.
T squared equals F. The advantage of the ANOVA is that ANOVA allows you to do more than 2 groups at once. We went through an example of that. If you get 3 or 4 groups, you don't want to be doing a bunch of t-tests, because then you're going to run into type 1 errors. Instead of that, how do we control for the type 1 errors? Say again? Well, we do the ANOVA
And
first.
you do a post hoc test.
Then you do the post hoc test, and there are many different ones to choose from. Most people don't really care. And then you see which groups are different, but it's more conservative than a t-test. Then we moved on to the 2-factor situation, where you have 2 independent variables. You can look for a main effective A, a main effective B, and the interaction. First, we looked at a between subject design where 3 people here, 3 here, 3 here. It'll always be 20, 20, and 20, much more than that. That was a between group design. And then the final examples we looked at were these kind of mixed examples, because as you brought up at the start, you'd want to know where people start. So you have a within subject variable before and after. This could be a very popular design in OT, PT, and PA, because you want to know where people start. What effect does your treatment have? Your control group, you wouldn't want to put them through it. Does the study that I published, the last one that you look at, answer the question about if I had just run it as a pre-test, post-test, which is what I showed you last time? Do you remember what the main compound was there? If I started in September,
It said seasonal.
seasonal, But if I have the control group here, what do? I've eliminated that. The control group was the same in September as they were in November, so now I've got a randomized control behavioral trial looking at the effects, and that gets peer reviewed. The journal actually went out of publication after this issue, not due to my publication, I hope, but because they didn't have any money left to support it. But we got published in this particular journal, and that's my story, and I'm sticking to it. So do you guys have any comments or questions for me at this point? So to kind of wrap things up here, we won't be meeting, I don't think, for at least a couple of weeks here. I think it's
After Thanksgiving.
after Thanksgiving. At that final presentation, and this might actually be, do you guys run correlations and regressions with things? We're going to do a correlation regression situation, and I think a lot of people do that because with correlations and regressions, you just give out a bunch of surveys and you look at relationships, you try to predict things. They're not, psychology people are more into manipulating variables and measuring things. So when we do the last class presentation, we will have a data set with SPSS, and we'll show you how to do that, and we'll go through correlations first. I'm going to assume most people know about correlations, a brief review on that. Simple linear regression we'll cover, which is one predictor, one DV, and then multiple regression and how that works. And not to do some data analysis because I'll have one data set for you that we can do these things on, but then show you what the output kind of means and how we can interpret it. So that'll, I think, do it for the day. Thank you for your
You don't
attention.
necessarily have SPSS up and running next session,
Or
or do you?
I will have it on the screen.
Okay, good.
So I think if I have it on the screen and you just see what I'm up to,
That's fine.
that'll probably be fine, and I can save that as well and send that out if it's of interest. But yeah, if you ever need any help setting it up and running it, I can be useful there. I hope you feel better.
Thanks.